Hello and welcome to the AMA Update video and podcast. AMA President Dr. Jesse Ehrenfeld recently moderated a panel at South by Southwest about the future of AI in healthcare. And today, Dr. Ehrenfeld is joining us from Milwaukee to share some of the highlights and key takeaways from that discussion. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Dr. Ehrenfeld, so glad to have you back.
Thanks for having me, Todd. Great to see you.
Well, throughout your presidency, you've spoken a lot about digital health at conferences all across the country. I'm curious, what was unique about speaking at South by Southwest?
Well, South by Southwest is like no other venue. It's this incredible conference really dedicated to creative people, helping creative people achieve their goals. It was created in the 80s, happens in Austin every year. It's really known as this sort of conference festival, music place with a convergence of technology, the film industry, music, education, culture, and healthcare.
And that's an interesting part, that healthcare part. And moving to your particular panel, I love the title of this, AI, Healthcare, and the Strange Future of Medicine. So we're going to talk about that. And in your opening remarks, you helped set the stage for the discussion. Why don't you give us a little bit of an overview of what you shared?
Well, this was an audience for creators and innovators. And so, everybody understands what a mess healthcare is right now. And access challenges, costs, all of the struggles that patients face when trying to take care of themselves. And what's so exciting for me about AI is that there is so much potential to improve every aspect, right? How do we deliver the care? How do patients experience the care? How do we train the next generations to deliver the care? How do we educate and re-educate physicians in practice? And if AI delivers on any of those promises, the healthcare of the future will be unlike anything we've ever experienced, and we need that. And we also need a lot of creative innovators to help us shape that future to make sure that AI can deliver on that promise. There's so many steps that we need to take to make sure that a technology that's really in its infancy can help us deliver the care process, not worsen bias, worsen health inequities, but effectively fill care gaps, lift people up, lift up all communities, and that's really what the conversation was all about.
And I love the kind of mix of the panelists, kind of getting to what you were talking about. You had somebody from a health system, a person from an academic institution, and a person from a startup. So that's kind of an eclectic bunch of folks. What were the top three takeaways from the discussion?
Well, not just a wide range of individuals, but three physicians from those kinds of institutions. So the physician from a startup was talking about, how do they make sure that a patient-facing tool that uses algorithms, they're incorporating AI, integrates into the care delivery system in a way that actually makes it easier for patients to get connected to the care teams that they need to ultimately solve the problems. The physician from the health system talked a lot about how do we make sure that we have standards, connectivity that can support the innovation that's happening across the ecosystem. And the physician from the health system talked about what it's actually like to use some of these emerging tools in their practice, in their health system. What are the considerations around acquisition of new technologies in the wild, and how do we make those things more smoothless for future adopters?
Now, it's interesting when you were talking about the background on South by Southwest and you kind of talked about the roots of it, and then you added healthcare to that mix. It is an interesting development, and your panel was just one of a number of different panels at the event that were focused on the future of healthcare. What else did you see that you thought were really hot topics at the conference?
Well, at this conference, there's a lot of energy around speech, expression, creativity, right? Because it's film, it's concerts, it's technology. And so as you can imagine, there's a lot of conversation around democracy, around access to healthcare, around speech, reproductive rights, healthcare access, all sort of converging in a really, really interesting place. We are continuing, as you know, to see attacks on personal decision-making, attacks on the doctor-patient relationship, attacks on patient autonomy to make the most important, sensitive healthcare decisions for themselves. And that was clearly top of mind for a lot of folks in a variety of sessions.
Now, back in January, You also were at the Consumer Electronics Show. So now you've got kind of two of these big events where I think people are probably more used to seeing companies like Samsung and Microsoft than they are the AMA. Why is it important for an organization like the AMA and these other kind of healthcare leaders that you were part of your panel to attend events like this?
Well, there's really two reasons. The first is we've got to be where the innovation's happening so we can help shape and drive it. That's why we've made such an investment in our innovation ecosystem, the Physician Innovation Network, free online platform to connect physicians, students, trainees, and companies, entrepreneurs, technology developers. It's a driver behind our investment in Health 2047, an innovation studio out in Silicon Valley. But also, we have physicians going to these meetings, and that didn't used to happen 5-10 years ago. And I was amazed. In fact, one of the audience members at South by Southwest stood up and said, I'm a physician, I burned out, and I decided to change careers. How can these technologies prevent people like me who love medicine, but just couldn't take it anymore, stay in practice? And so, we're seeing lots of physicians at these meetings, and we obviously want to be there to support them, to learn what's happening, to make sure that the AMA is ensuring that we have technologies that work for everybody.
And there is so much potential for these technologies to take some of that burden off physicians. It's exciting, I can tell from just your responses, to see all that innovation. And Dr. Ehrenfeld, thank you, because I think a lot of your energy has gone into this and you're kind of leading the way here. So thanks for being with us today. The AMA is committed to making sure that AI and all technology that physicians use are assets, not burdens to them. So to support that work, I encourage you to become an AMA member at ama-assn.org/join. That wraps up today's episode, and we'll be back with another segment. Be sure to subscribe for new episodes and find all our videos and podcasts at ama-assn.org/podcasts. And again, thanks for joining us. Please take care.